Hello, students. We are back with aminoglycoside antibiotics today. This is another edition in our antibiotic series where we target the most tested upon antibiotics, not only for nursing school, but for standardized tests such as the NCLEX. We are going to target the most key components of aminoglycosides that are tested upon, including indications and specific disease processes treated, side effects, and most importantly, how to identify an aminoglycoside apart from other antibiotics. If you enjoy content such as this, feel free to like and subscribe as we will continue to put out videos to assist you throughout your nursing school journey. Aminoglycoside antibiotics. Aminoglycoside antibiotics are what I like to refer to as the atomic bombs and heavy hitters of the antibiotic class, meaning that these are very potent and broad spectrum antibiotics that are utilized to treat a wide array of disease processes. But they also unfortunately cause some very toxic side effects that are very important for the nurse to monitor for. We'll dive more into these when we reach the side effects, but we are going to start with how to identify a aminoglycoside amongst other antibiotics. With the acronym GNT, you can identify the three most tested upon antibiotics in the aminoglycoside classification, which are G for gentamicin, N for neomycin, and T for tobramycin. These three antibiotics are aminoglycoside antibiotics. Now, I do not point out any specific suffix because, as you see, that mycin that most of these end in, they're very similar to other antibiotics such as clindamycin and vancomycin. So, with the acronym GNT, it makes it a little bit easier to narrow down your aminoglycoside antibiotics. For indications, which specific disease processes do aminoglycosides treat? Now, it's more of a broad list because again, the broad spectrum aspect of aminoglycosides does increase the amount of disease processes that they do treat. Some of the most common ones that you're going to see are things such as drug-resistant tuberculosis, zoonotic infections, and pulmonary infections that usually fail course with other antibiotic treatments. Now, side effects. The side effects I want you to read and bold out as these side effects do pose a great safety risk and need to be monitored very closely because of the therapeutic index of aminoglycosides and the high risk for toxicity. Now, again, remember the heavy hitters of the antibiotic class, meaning that they are very effective but do have a high chance of not only toxicity but of causing great side effects. The two most common side effects you're going to see in regards to examination purposes is number one, nephrotoxicity, meaning toxicity to the renal system. As a nurse, you need to make sure you are monitoring the creatinine. Any creatinine we know higher than 1.3 indicates some type of acute renal insufficiency. And number two, monitor the patient's urinary output and ensure that it is within the patient's baseline and not decreasing. So, again, nephrotoxicity, we monitor the creatinine levels and the patient's urinary output. The second side effect you need to make sure you monitor for is ototoxicity. That is toxicity to the hearing system. So patients with ototoxicity are usually going to manifest with signs and symptoms such as unresponsiveness and a decrease in communication. Two, signs and symptoms relating to vertigo. As we know, the hearing system and our ears play a great role in the equilibrium of our balance and gait. So, signs and symptoms of ototoxicity can include vertigo and issues with the balance and gait. Now that we've gone over the key components of aminoglycoside, we are going to re-emphasize 3 points as these are usually the three most tested upon key points. So I want you to underline and emphasize these 3 points. Number one, you identify your aminoglycosides with the acronym GNT, gentamicin, neomycin, and tobramycin. Number two, Aminoglycosides are heavy hitters, meaning that they have a very narrow therapeutic index and have a great risk for toxicity. And number three, the most common and serious side effects for aminoglycosides are nephrotoxicity and autotoxicity. So monitor the renal system and your client's hearing. That concludes aminoglycoside antibiotics class. I will see you at the next video where we will continue to dive into the most tested upon antibiotics and overall medications in the pharmacology class.